coming off a long weekend, do you have any advice for us, Dr. Moore?
Well, after a long weekend, as your medical officer of health, I get a little anxious because I know people have socialized. They may have traveled outside of our region, and outside of our region typically have higher rates or risk of COVID-19. So please be careful. First, second, third was the long weekend. We, over the next 2 weeks, will be hypervigilant in monitoring the lab data. We know that most people will develop symptoms of COVID-19 roughly after 5 to 7 days of having been in a social setting or have traveled outside of our region. So this coming weekend and for the next 14 days, your health unit will be monitoring the data very closely. Please monitor your symptoms. If you have any symptoms compatible with COVID-19, please go to one of our assessment centers in KFL&A. So that's fever, cough, increasing shortness of breath, any respiratory symptoms, and sometimes people also get nausea, vomiting, or diarrhea. So any new symptoms, please consider going to our COVID assessment centers. Also, I would please ask that if you work in an aggregate setting or with vulnerable populations, you become hypervigilant on any new symptoms and take avail of any testing capacity either through your employment or at the assessment centers. So that's in particular if you're a healthcare worker, you work in a long-term care facility, retirement home, corrections facility, or any congregate setting where vulnerable patients are housed or homed. Please consider monitoring your symptoms very closely and always take best practices when in the workplace about hand hygiene, masking, and adhering to best practices in infection prevention and control. This will keep our community safe. It's times like this, long weekends, that we all have to be a little more vigilant for the next 2 weeks thereafter.